I think it's very timely that this came forward from the American College of OBGYN because clearly oral contraceptives, which are the most common contraception used by women in the United States, needs to be made more accessible. And I really think that making it an over-the-counter medication is going to allow more women to have access, to have easier access for something that is a need for the majority of women. And if you look at the studies on this, 68% of women who are at risk for an unwanted pregnancy would be more comfortable using an over-the-counter medication. So I think it is an important part of the services that we offer to women. One of the issues with any medications, be it over-the-counter or prescription, is there are always risks associated with them. And then you have to balance it against the benefits of the medication. And since the birth control pill was first discovered in Worcester in the late 1950s, early 1960s, it really has markedly decreased in dose. And along with that, the risks have gone down. The primary serious risk associated with birth control pills is the risk of having a blood clot form, but that risk goes up from 1 in 10,000 women to 2 to 3 in 10,000. And if you compare that risk to the risk of pregnancy, where it's upward of 20 in 10,000 women, it's better to use a birth control pill risk-wise than to have an unwanted pregnancy. So I really look at it as, yes, there are risks. Women need to be aware of them when they get this medication. There has to be some form of communication about the risk of this medication, but I think that it's not of such high risk that it couldn't be available over the counter. So what happens when it's available over the counter? How are we going to, now that it's covered by insurance, how are we going to deal with the situation when it's over the counter? And I would say that that really needs to be resolved, looking at that from a legal standpoint. Is it something that there could be some form of decreased cost or potential compensation from insurance, since it's to be covered by insurance, that would somehow still allow it to be over the counter? I'm not sure what the final answer will be on that. I agree that's an issue, but I think that going forward with it being over the counter is important, and then we can work on the financial issues in the future.